Well, Dr. Taylor, welcome to Charm City.
Thank you. Thank you.
So let's get this going.
Absolutely.
In what ways are the impacts of redlining and other longstanding systemic inequities that shape health in Baltimore similar to those that you've dealt with in Shelby County?
Absolutely. So first, it is such an honor to serve this great city. Welcome to all of you all to Charm City, my new city. The accent that you hear is Memphis. But I am so honored to be the next Commissioner of Health for Baltimore City. And the reason why Michelle is asking me this question is because she heard me tell a story about when I was a pediatric resident and I visited the Shelby County Health Department for the first time. And vital records I found was color categorized by race. And I knew that because I was in a group of residents who we were all training, we were all spending our week at the health department. It was my first time in the health department, even though I was a native of Memphis, but the other residents weren't from there. And the first room we went into was vital records, and the lady that was over it opened the drawer and she said, "What do you see?" Other residents were just puzzled, and I knew exactly what I saw because my family had grown up there. My parents were both born and raised there. Orange cards for African Americans, white cards for white residents, yellow cards for babies that were stillborn that year. And so I tell that story often to remind people that the policies that were created many, many years ago, you're sitting in the birthplace of redlining, affect health, affect population health even today. But the good news is that we know that with good policy, we can also affect health. And that's why all of you all are here, to lend a hand, to lend your expertise, to lend what you know, to protect and improve the health of the populations that you serve.
Yeah. So as you're taking on this challenge of Baltimore and the issues that you're seeing and the issues that are facing, we know that we have seen declines in overdose deaths. We've seen declines in violence. Here in Baltimore City, how do you begin to prioritize given our historic policies, the structures, but yet the innovative approaches and the opportunities that are possible?
Absolutely. So what you must always remember is that there are questions that you have to ask before you can start to prioritize, especially in a local health department. What are you statutorily required to do? That has to get done. Everybody knows that. Whatever organization you work for, there are things that you are required to do in your position and in your sphere of influence. The second is, what do you do better than anyone else? You may not be required to do it, but there's no organization that can do it better than you. And finally, what are the things that maybe you don't do as well? You're doing them, but if you partnered better with an organization that does do it better, how would that improve? I was sitting in a meeting yesterday with a group of judges and lawyers and other folks in social services dedicated to overdose response and behavioral health response. And we talked about, at the end of the meeting, what does it mean to be somebody from start to finish who has a mental health crisis, enters the system, is mandated to treatment, and then they have treatment because of insurance coverage, but maybe they're not getting all the resources that they need during that treatment, just for the extra things. What does it mean to only get $30 a day for basic needs? What does it mean to not have any extra resources, and how does that feel? The reason why I love public health professionals and people who have dedicated their life to this work is because even if you haven't had that lived experience, you have dedicated yourself to figuring that out for people who are having that lived experience. And that is how we get to better policy and better health outcomes for everyone.
So you talk about the whole person, from birth through the entire life cycle. What are the ways that you think Baltimore needs to, what are the opportunities that's before us here in Baltimore?
Let me tell you something about Baltimore. And the reason why Dr. Jaraza and Dr. Sharfstein and yourself convinced me to come here. I could have stayed in Memphis. I could have ended my career in Memphis. There are people in this room who know that. And everybody was surprised when it was announced that I was coming here. But Baltimore has something different going on right now. Baltimore has momentum. You can feel it in the air. You can feel it in the work that people are doing. But Baltimore also has the means right now to really respond, not only to overdose deaths, but to a myriad of other issues, and has already been responding to help families, to help community, to help in reducing violence, all of those things. And Baltimore is making significant investments in all of these areas and more to make sure that smart policy is going to actually helping people. And Baltimore has the motivation to do these things, right? So everybody in this room understands that there's only so much you can do, but when there's no political will to do those things, you can have all the money in the world. You can have all the motivation in the world, but if you have no political will among the people who are serving you as elected officials to get things done, to improve policy, to do the things that need to be done, to really, really fill in the gaps for folks who don't have resources, and really to fill in the gaps for an entire community, then you can't get it done. And so I will tell you that Baltimore is special. I'm so excited and so honored to be here. And I know together we can tackle even more than has already been tackled before I got here.
So thank you for that. Let me ask you in the 1 minute and 10 seconds we have remaining. There are policy challenges, there are funding challenges, there are opportunities that we have yet to explore. There is issues across our 5 focus areas that we still need to hammer out. There's disparities based on the 20-life gap based on where you live within Baltimore City. And we know Baltimore City is made up of neighborhoods.
Right.
What are the things that you want us to walk away with, being hopeful about in this moment, given the challenges set before us?
This is what I would tell you. Remember that the colors mattered on those cards. And even though this is the first time we are living through times like this is not the first time that folks who look like us and have had lived experiences like us have dealt with these type of challenges and more. We have every single thing we need to be successful, and no amount of barriers are going to stop us. That's why you all are in this room, because you have decided that no matter what the funding is, no matter what the political climate is, no matter what somebody says in misinformation or disinformation, that we are the experts in the room, and that's not a dirty word. Because when we bring our expertise and our strength to an issue, there's absolutely no one that can stop us. And we must continue to speak out.
Well, we're at time, and I think that's a great way for us to end our conversation. Part of me wants to ask you about the importance of data, but you said it. And I want you to respond. Just give us a second about
You're going to get us in trouble, Michelle.
I know. I'm not looking, that's why I'm not looking at any of our producers.
Data is super important. That was the way I made so many changes in Memphis and Shelby County. Because not only were we collecting the data, but we were taking the data and the information back out to the people. Always remember, you must give the public more credit than we normally do. They understand way more than we give them credit for. And when you arm them with information, with the data, they'll be better champions than you ever could be, because they know what the gaps are. They live in those communities. They sleep in beds at night and hear what's going on outside their window. And they know what it takes, but they need to be armed with information to make sure that they are helping you in effective ways to make sure everybody's health improves.
And with that, please join me in thanking Dr. Taylor.